our global conversation about our futures, creating a space where all generations, especially young voices, can share their visions, concerns, and action-driven projects towards a better tomorrow. This will be streamed on YouTube, so let's make this conversation count. Share your thoughts and join the global discussion using hashtag WFDYV. So Grayson and Linda, take it away.
Right. Oh no, I'm not muted. Okay. So hello, I'm Grayson Rents, and Linda and I will be presenting. Thank you, Matthew, for introducing us in the session. We are going to start off with like a little bit of an introduction. We just want to know where everyone is from, and if you would like, you can um, change your name in the chat or in your rename, or you can list it in the chat. And just to kind of keep track of where everybody's from, and as we're going along with discussing the different regions of the world. And as a reminder, just everybody practicing internet safety, just stick with your country and your region, not to get any more specific with that. And I am going to pass it on to Linda.
Okay. Grayson, are you going to put the slides up on the screen or?
Oh, is it? I did
Yeah, I
screen.
thought you were going to put them up, but that's okay. I
I
think
thought
I
I
can do.
I thought I did the screen sharing. It's not.
Let me see.
Hold on. Wait, I think I got it now. Here we go. Can everybody see it now?
Yes, we can see it. Thank you.
Okay, perfect. I'm sorry about that.
Okay, thank you. Um, so with our agenda here, you can see we're going to spend just a little bit of time getting to know where you are from the different parts of the world. I saw somebody put in the chat that they're from Cabal. Was that it? Let's go back. Malaysia. That's good. We'll want to hear about what's happening there. And also in Michigan. So you're not too far away from us. That's good to know. We're going to spend a little bit of time reviewing the global challenges, 8 health issues, and then the bulk of our time is going to be spent talking about regional considerations. We'll have an introduction to the futures thinking tools, and then we'll do an empowerment exercise where we'll hopefully empower you to defy disease. And then we'll need a few minutes. We want to allow the World Futures Day program to do their closing and to be sure that you do your surveys and things like that. I must say that I've attended a couple sessions today. I have been really, and yesterday, for us it started yesterday. I've been really impressed with the programs that I have seen. I'm also curious of the number of people that are here, how many, if any, have reviewed, I know Grayson has, the Global Challenge 8 health issues. If you would either raise your hand or put a comment in the chat to let us know if you're already familiar with it. Because if you are, then we don't need to spend a whole lot of time talking about it. Well, I'm going to recap it a little bit on the Global Challenge 8. Oh, we've jumped ahead. Okay, that's okay. Thank you, Grayson. The video was posted just about 3 months ago, so there's probably the majority of us haven't seen it, but because healthcare issues are really important to Grayson and I, we did take a look at it. And we were excited to see that the Millennium Project has given a lot of reasons for optimism about the way things are going right now globally in health, that the human life expectancy has increased considerably. They're optimistic about the amount of money that's spent towards the issue. It's more than 10% of the global economy. There's been tremendous progress made in the treatment of HIV. At least 75% of the people that are in need of treatment are receiving treatment. Another reason they're optimistic is the use of vaccines, specifically the genomic type, which are DNA and RNA based, and those are quicker to be developed. And there's some possibly being tested on a vaccine that would boost the human immune system, and actually by inserting DNA or RNA into the cells, create proteins that would train the immune system. And that would be a huge step forward, because then the expectation is you wouldn't need necessarily a vaccine for every disease, just boosting the health in general. And then another reason they're very optimistic is the increased use of telemedicines, AI, a lot of reliance on technology now as part of our health solutions. But of course, they highlight some concerns that exist right now in global health challenges, the number of pandemics and epidemics that we're experiencing, the connection between climate change and some of the pandemics due to animal migrations, the number of superbugs, antimicrobial resistance, things are a concern, and I know that's something that really interests Grayson, so he's going to share a lot of information about that. But one of the things that really surprised me in their video was that 1.6 million people a year die from fungal infections. Would you raise your hand or put a comment in the chat if you knew that the death rate from fungal infections was that high? Because I knew it was serious. I did have someone who is very important to me nearly die of a fungal infection about 10 years ago. So I knew it was serious, but I did not realize that it kills more than 1.5 million people a year. So when I saw that in their video, I was really touched about the seriousness, and how I'm glad that the Millennium Projects and others are working towards global health. So Grayson, we want to be sure we get some more information on other parts of the region. And if you're part of the audience, when Grayson's presenting about regions of the world, we want to think about the questions that the Millennium Project put forward, which is, how can the threat of new and reemerging diseases and immune microorganisms be reduced? That's their headline question on the video. And how should we prioritize how funds are spent for infectious diseases? So Grayson, do you want to go ahead?
Okay, so starting with Africa, the strides in health and the challenges and outbreaks, that's going to be a common theme throughout the presentation. So Africa, they have had some huge improvements with these different illnesses. So one primarily being the new malaria vaccine, that's effective. And this vaccine has contributed to reducing 75% of new malaria vaccines since 2023. The Ebola is preventable and curable, which just 10 years ago, if anybody remembers how much of a worldwide epidemic Ebola was and how much that affected everyone, it's been huge that it's just 10 years from now. And Egypt has eliminated hepatitis C within 1 year through a screening, free treatment, and retesting. So everything was free. Nobody had to pay for anything, and they eliminated hepatitis C. Their challenges and outbreaks, though, So a big issue has been measles, mpox, and chorea. This epidemic started in the city of Goma in the Democratic Republic of Congo, and it has spread across 21 countries. And some of these reasons are because of hygiene, sanitation, and um, just poor infrastructure and just instability overall. So these reasons are we're going to be seeing a lot more of, and the clean water, sanitation, and hygiene is a huge common theme, and it's also called WASH throughout a lot of different resources that you'll see. So currently, they are short 1.5 million healthcare workers, and they are expected to be short 6.1 million by 2030. And the issue with that is because the less healthcare workers we have, the less we're able to treat and prevent disease. So, Asia is the most progressive region, and one of the things is just how, because if the rest of the world can follow the most progressive region, then we can become a better world in treating these reemerging diseases and treating the issue of AMR. Their strides in health have been really significant in the maternal mortality rate, which has decreased over 20 years in East Asia and South Asia. China, their digital hospitals have at this point, they are almost at 3,000, if not even higher. And the main reason really for that escalation is due to the COVID-19 pandemic. Visceral leishmaniasis is a very contagious disease, but the Indian region almost saw a 100% decrease since the spike in 2011, and they're currently maintaining and they are currently steady. And that's another question as to how are these places able to do that, and how can we across the world follow in their footsteps? As for their challenges and outbreaks, in the United States right now, bird flu is a very significant issue right now. And I don't know if anybody else around the rest of the world is having issues with bird flu. But when it started in Japan in 2023, the removal of the 330,000 chickens has not only affected them, but it's also affected the food that is sent throughout the rest of the world. And it's also, it's just spreading. It's turning into a pandemic, and that's very unfortunate. We want that to go in the opposite direction. And after 20 years of maintaining treatment for malaria, the rise in deaths have increased 29%, with the Pacific Islands being 40 times higher. Tuberculosis is another illness that is going to be more prominent throughout the presentation. Papua New Guinea and Nepal over the last 4 years have had issues with being at higher rates. But recently, with the success rate for new TB cases, with a new vaccine and just better overall treatment, that is now at 85% effectiveness. So as you can see down here with air pollution, either by a show of hands or in the chat, how many of you guys would have guessed that air pollution is a leading risk of death? Because I feel like that's not something that very many people think of. You feel it every day? Yeah. The air quality is such a big issue. It's really unfortunate. And the question is what do we do about it? That's really what this is all about, is what we can do. Um, as for Europe, their strides in health are are very significant to what we are going to be aiming towards today, which prevention. And that's a huge part of reducing any type of disease. Their section of the World Health Organization has been making that effort towards reducing antibiotic consumption, campaigns, especially towards and attractive towards younger people, because we are the face of the future. We are going to be the ones that are continuing these campaigns, and also monitoring their environment to make sure that everything within that environment is being maintained and animals aren't spreading those diseases and such. They also have a new treatment and vaccines for Ebola, which is again phenomenal. And when we do think of health, I wouldn't personally think of implementing drug testing in schools and universities. It's not something I would think of. But it is definitely a different approach to health, a different aspect of health that I think is good that it's being brought to light. As for their challenges and outbreaks, their deaths from TB have risen after 40 years of a decline, which is, I don't know, to me, that's pretty shocking. I was very surprised by that. Russia's spending on healthcare is half of the GDP global average, which is 10%. And that significantly affects their healthcare systems for sure. Deaths by AMR could potentially surpass the death rates of cancer by 2050. And currently they are at 35,000 per year. Latin America has had significant successes in having the highest life expectancy and vaccination rates in the developing world, which makes them a leader. They are for sure doing something right. That's for sure. Most HIV/AIDS treatment across all WHO regions, elimination of canine and human rabies in almost all of their countries, and 3 of them are malaria free. Going on down to the challenges and outbreaks, dengue, also known as yellow fever, has been a matter of an outbreak for quite a few years, and just in the last year, they had 13 million cases, and it is currently spreading across 23 countries. For Latin America's sustainable development goals, they are not expected to reach 32% of their goals due to primarily setbacks of the COVID-19 pandemic, but also health inequality, mostly income driven, as well as other risk factors, which has made their goals expected to be reached only at 22%. North America, a One Health initiative. So this is something I am not sure how popular it is in other countries. I know there are in other areas. But as for the One Health initiative here in North America, the goal is to balance optimizing human health as well as recognizing that our behaviors, animals, and the environment contribute to health effects, disease, treatment. Um, it takes multiple organizations, communities, and various regions such as Canada, United States, and Mexico to work together for a One Health approach to be effective. And it can be local and regional. So it can be within a country, such as like within a state or a province level. But one of the main examples is the North American Preparedness for Animal Health and Human Pandemic Initiative. So this is an organization that is between Canada, the United States, and Mexico, and they ensure that all three countries are unified on health health security and communicating each other with clearly with health and what's going on to try and maintain and prevent outbreaks. A potential local example is community programs that aim to prevent illness through education. And as for another challenge is, or I'm sorry, another stride is after 15 years of campaign vaccinations, the Americas have eliminated rubella completely. A major significant issue in the United States is AMR causes over 250,000 hospitalizations and upwards of 14,000 deaths per year. So, due to the overflow in the healthcare systems as well, these are a contributor, and the amount of these deaths is just astronomical, honestly. The number of Canadians with chronic illnesses by 2040 is estimated to be 3.1 million. So the chronic illnesses can also be multi-morbidity, which is essentially they have two or more of chronic conditions or morbidity preventing illnesses. And the diseases with common age, dementia, cancer, diabetes, osteoarthritis, those are all climbing and contributing to that as well. So we want to hear some feedback from you guys about the information that has been said about these various other regions. If there's any other additional information that you guys want to add from your guys' personal experiences. Let me see.
If you want, go ahead and unmute yourselves. In the chat, I see that Scott said some things about Asia. He provided the feedback on Asia, that one of the reasons he thinks they may have, he was responding to that idea of why did they do so well? Why did they make improvements faster than other parts of the world? Is the digitization of healthcare, that they moved to actually treat on demand and doing preventable approaches instead of firefighting. And that it could be a cultural aspect too, that they boil their water and drink hot beverages. But Scott, if you want to unmute yourself and tell us more about your thoughts on that. And I think you also commented about the fungus issue and the prevalence of that. So I'd love to hear more about what you think on that.
Oh yeah. Thanks. I don't actually know a lot about the fungal infection bit. Although I imagine if I was to think about it, I think people don't see that as a problem, and they don't think to seek out help for that until it becomes a big issue. The other problem with fungal infections, they're very difficult to remove, and the medication you have to take is not kind. Because I've actually suffered from one, and I know, and I don't do well with antibiotics in general, and I typically try to avoid them because there is an issue here in Asia, and I'm sure it's fairly global as well, this overprescription of antibiotics, which explains the whole AMR issue as well. That I was also kind of against the whole, because every time we have a pandemic, whether it was the COVID one, or if you can remember, when I was in university, we had H1N1, and I remember hand sanitizer being like every, 10 feet, you'd see a hand sanitizer thing, which interestingly stopped getting refilled after that was a big problem until COVID came around, and then those started getting refilled again. But people get really, um, crazy about that. And so overdoing it, that creates bigger issues for, I think, antibiotic resistance, because the more we keep using these like slash and burn techniques, we don't realize the second and third order impacts that come with that. But the biggest thing in Asia that I've noticed, because for about 250 US dollars, I can get a full body scan here in Malaysia that checks for everything, checks for cancer indicators, checks all of my how well I'm doing and various little health indicators. You spend a whole day at the hospital basically, and they just kind of test everything. If we had more things like that, and of course, as an American, I'm a guy who I'm adverse to going to the hospital because every time you go to the hospital, it's a bill. And you're like, how much money is this going to be? How much money is this going to be? And then, of course, living in Malaysia, where it's a much more socialized healthcare system, except for foreigners. So again, the problem still arises for me. But where you don't have to think about those concerns, where you can actually go and get treated, and you don't have the mental holdbacks or the cultural holdbacks because of how society is structured. So I think there's a real deeper problem, and that's why because even in Malaysia, we're not quite at that preventable phase yet. Because we also don't there's social concerns. So, for instance, I think HIV is a huge issue in Malaysia, but socially, we don't want to recognize that for a variety of reasons. Likewise, there's problems with diabetes and heart disease, which are pretty typical genetically for people of South Asian, Southeast Asian descent. But if we took a more preventative approach, looked at public health initiatives, looked at health education, dietitians, some of these things. And so it's a culture that is heavy on rice because it used to be very labor dependent. So people used to work in the fields all day. Now people sit at desks all day. So when you sit at desks all day, eating that much rice is not a good idea. So yeah, just a lot of different kind of ideas kind of in that area. So.
Thank you for all of that. That's I know you mentioned the bill, and this is something I didn't add, but the United States says 20% spent on healthcare in accordance to 10% of the world GDP. So, and even at that, that doesn't necessarily mean our healthcare is better, or it's as effective necessarily because of all that prevention and the socialized approach to healthcare also. Um, so we were supposed to have a poll, but we're having some issues. So if you guys wanted to respond to these questions in the chat, or if you guys want to unmute or just reflect on that, um, you guys can feel free to do so. That's completely fine.
Thanks.
But we were supposed to have a poll up.
Yeah, thank you for pivoting, Grayson. Troubleshooting the poll at the moment, but I like that you were able to pivot, and maybe we can do just that.
Mhm.
And
Yeah, and that's fine. We can even, that can just be an ongoing part of the conversation too. That's no problem.
my
Um,
question though, in regards to the discourse happening, allergies. A lot of people are developing allergies. Is there a connection with the diseases and allergies, would you say?
that is a good question. So I would say that with allergies, it's, environment, like as in the One Health initiative, environment plays a huge role in health and wellness. And, our environments aren't that great. So I don't know if that could potentially, like maybe the increase in pollen, or I would say maybe depending on what people are allergic to, that might have different factors. So like if they're allergic to animals, if that develops, or if they're it could be something with the antihistamine change in the response of their body that potentially something they interacted with in the environment or um, different types of exposures could have possibly changed their antihistamine response. But as in the diseases and everything that I'm not so sure about.
Okay, thank you though. Yeah, I didn't expect an answer. I was just curious because a lot of yeah, allergies, they seem to be prevalent. Maybe also in places where maybe pollen isn't high, maybe the food allergies or so something to think about, something for me to research upon.
Yeah. Yeah, the food allergies, I think it could be something with you know, in like animal product consumption maybe. It's a thought. I don't know, but yeah, it's something that I could look into also.
Yeah, also I worked for a chiropractic office a while back and uh for skin fungi for fungi on skin or
Hmm.
skin disease of some type supplements as an alternative. Curious if you know about that avenue.
It's an interesting one.
Okay.
It's I've heard a lot about it. I know some people that they do take a lot of supplements. I know some people that don't. So that is it's something that's kind of like reemerging, or not reemerging, I'm sorry, but it's emerging, and it's you don't really know because some of them you can get from food, some of them you may not be able to. I think that's still something that people are still exploring also.
Right on. Thank you.
Hmm.
I'm going to respond to another comment from Scott in the chat where he says that traveling around the world, he thinks that healthcare needs to be a bit more socialized in the US and it's
Definitely.
beyond a Democrat and Republican issue. And just give you the feedback that Grayson and I actually met about 6 weeks ago. It's only been about that long, Grayson.
Hmm.
It was in January where we're both attending it's called Healthcare for All Ohioans, which is an organization that is exploring or advocating for social, what they wouldn't call it socialized medicine. They would call it a single payer system, but making sure everybody has universal access. So if you return from Malaysia, or if you're from Ohio, or you want to get involved, because we do have members that are actually in other parts of the world that take part in our conversations, and we love to have people from other parts of the world where they have positive experiences share that. And if we could redo, I think, what this session was about, I would have loved to have polled people to find out what is their experience in other parts of the countries because of other parts of the world, because of course we're told that, for instance, Canada's got to wait forever. And I think if we talk to everyday people, we might get some different kind of feedback on that. But I really want to thank Grayson for covering the regions like he did. He got a crash course in futures thinking by joining this with me just a couple weeks ago. And because of that, I didn't know how many people we'd see in the program who weren't too acquainted with futures thinking. But having watched others' programs, I realized so many of these people are very knowledgeable of futures methodology. So we can probably go very quickly through the next section and jump more quickly into what are we going to do to empower ourselves and empower communities around us. But Grayson, I don't want to cut you off. Do you want to discuss any more about the regions?
Well, I think all that is left here is just to say that oop, that there are many factors to reemerging diseases and AMR resistance. And a big question is a lot of people don't know where to start. And that's something to keep in mind is where do we start? How do we all get on the same page? And with that, I will pass it along to you, Linda.
I appreciate that. Thank you.
Mhm.
I'm gonna let you click through them on that screen. Um, I am going to ask this group how many of them need much of any orientation to futures thinking applied specifically to healthcare. I think for Grayson and I working together on this project, it was a good um, way for him to understand what today's event would be about. And what we really focused on was this article, The Emergence of Medical Future Studies Uncovers Medicine and Healthcare's Untapped Potential. And I recommend that article. I found it on I wasn't looking for it. I just found it and said, well, this is great material for today's program. And I wanted to recognize that it is the source that for educational purposes, we use to make most of the slides for the latter half of the program. But even the concept of thinking about multiple possibilities was something that we started talking about, that futures, you notice my slide there has an S on it because it's not so difficult now, I don't think, for people to realize that we think about multiple possibilities when we talk about the future. Historically, it tended to be a singular predetermined timeline that people conceived, and language was limited that way. And that's why we highlighted the S there, that there are multiple possibilities, and that's sort of unique to the field of futures thinking, as opposed to, say, business forecasting. Burton, when in his article, Bertolon, he recommended that we use futures thinking in the field of medicine because it's already been used for decades in business management and economics. And that's indeed the field and area that I came into future studies with, was business economics and forecasting career outlooks, and also used for marketing departments. He says, though, it'd be useful in the medical field because the medical field has tended to be highly subjective, where you ask an opinion leader for their idea and then make really important decisions based on what one person thought. So, for instance, picking up a Delphi method would be beneficial in the field of healthcare and medicine. And of course, if you're familiar with futures tools, you know that the goal is to shape the future. And that's why he wrote this article, to encourage people to pick up more skills to do that. And he pointed out that there's about 50 different kinds of methods. So there's surely going to be something that we could use. If you go to the next slide. So he had a chart in his article that had 10 categories of futures tools, and we're just going to look at 4 of them today. Consequences, which looks for ways to make connections between cause and effect. Scenarios, which are really popular and fun to work with as they help us visualize situations so we make better decisions. And then trend analysis, which in the business world tends to be data driven and based on a lot of numbers. But I love his example because he uses a scanning framework. It's more about environmental scanning, and he brings in nuggets of information. He's bringing in qualitative factors that help you think and look for a pattern. It's not the numbers that are driving the pattern. It's the nuggets of what you see happening on the horizon. And then the last example he had in his article that we're going to share today is evaluating possibilities. It's horizon scanning. And I'm going to go through this very quickly. So if you'll go to the next slide. And I'm going through it quickly because I think a lot of us here are familiar with the tools, more than I expected. In the last session that I was in about chat, and I think Scott was in there too, in the use of chat, they used a futures thinking wheel, and they actually did an exercise walking us through it. And so if you were in that session, you saw that this is useful. And indeed, it has been applied in healthcare, in the healthcare field too. But when you use the futures wheel, it's important that you put your statement in the center. Then you look for your primary and secondary consequences, and how his is different. His futures wheel is different than the one used in the last session. Is he has those 8 outlying parameters that he's looking for. What are the impacts in different parts of society? What's the impact on our ethics? What's the impact on our legal system? What's the impact on culture? But however you design your futures wheel, you can change that outlying section. The one they just used in the previous session looked more at timelines, 5, 10, and 15 years out. And this particular graph that he had looked more at what's happening around us. And I'm going to go ahead to the next slide, which shows an example of a futures wheel being used in the field of healthcare. This one was specifically on COVID, and it's referenced in Mesco's article. So if you would like to know more, you can either reach out to us or look for Burton Mesco's article, and you can pull up this futures wheel. So in the interest of time, we're going to go to the scenarios section. Mesco provided for scenarios a fairy tale example, and any scenario is a description of possible actions or events in the future. And the product might be an outline, it might be a synopsis, it might be a story, it might be an imaginary headline, it might be a hypothetical letter. It's some way of communicating details about what might happen. But in the fairy tale one, what he recommends is that you hold a core value and then you create 3 versions. A utopian version where that core value flourishes and everything turns out well. A dystopic version where the value gets eroded, things don't turn out so well. And a middle ground version, which is then tends to be the most realistic version. And for instance, with the Millennium Project that we were reviewing on health, you could create 3 scenarios about the use of telemedicine and AI to reach areas of the world that do not have enough healthcare workers. And the core value that you might want to hold in creating those scenarios is to respect the local culture and the local culture's own practices, which tied right into what one of the presentations was today about Indigenous people and health. That was a great one. Watch it online when they post that. Then from that scenario that you have, you would backcast to think about what steps brought you to that point. And you use the step analysis to make better plans in your own. And I'd like to use the scenario forecasting tool with the core value that healthcare is a human right. So I'm going to go to the next slide. Futures thinking for trend analysis. This is basically an environmental scanning framework. The thing that really stood out to me on this is that it incorporated generative AI, that it's going to bring in massive amounts of data with the use of AI, and that's going to change trend analysis work. But the majority prior to this time frame relied more on people and journals and magazines. But the advent of AI in scanning is going to have a huge impact. And then lastly, he shows horizon scanning. And I do think most of the people that are here today are familiar with futures tools. And you may be accustomed to this idea of looking across the horizon of time and identifying when there is a change. On this graph that he provided, the little red rectangles are the weak signals of something is changing out there. And again, the last presentation had some good examples about that in digital space, where you see change slowly occurring. And then sometimes something really big and dramatic happens. It tends to be a low probability, but a high impact event. And that would be a wild card. For us in the health sector, COVID was considered a wild card. Or right now, in the past couple of weeks, they've been speculating about the possibility of an asteroid once again colliding with the Earth in 2032. So that would be a wild card if it happened, because the impact would be incredible if it did. But it's not a high probability that that would happen. But you do want to plan for things and keep tabs on it. Unfortunately, I have been keeping tabs since I came from the NASA community on the asteroid, and the possibility of it is decreasing. So we don't have to worry about that so much. So for today, that's the very quick lesson on futures thinking. Was there anything new in that material for somebody out there? And if you would, let us know in the chat if there's a specific method in the field of health that you would want us to discuss or demonstrate next year for the next World Futures event, because I know Grayson really enjoyed being a part of today's program and is already talking about how he wants to adapt and learn more of these tools. So what else would you like to see in futures tools? Or some of you that do have more experience with future tools already, what do you think might be important in the field of health to apply? Now I'm looking in the chat. A big trend when I lived in Texas. What was that?
Oh, it's basically like a subscription base for healthcare. So you didn't have to necessarily have insurance, but it was like an urgent primary care, and you could pay like a monthly subscription, and you can use it as much or not at all. Or you could pay as you go, kind of like a copay kind of thing. But it was just another like way to get healthcare in Texas, and they're kind of starting to do it with primary care doctors for people that don't have insurance, um, and like urgent cares and stuff like that, where you can, if you do go to the doctor a lot and you pay a subscription, it's just like a pay $100, you don't have to pay every time kind of thing.
But you're not in Texas anymore? Were you there for school?
No, I lived in Texas. I was in the military. And so I lived in Texas for a couple years. I still have a house out there, but so I go out there quite a bit, but no, now I live in Michigan, so I'm trying to spread the trend out here actually.
Thank you for your service.
Oh, thank you for the support.
I actually lived in Texas for a while too, and our primary care doctor went to a subscription service. And here in Ohio, every primary care doctor we've had has resigned in the past 6 years because of the difficulties they have in the health system. And they put a new person in the slot, and we still have health insurance or insurance through a network, but is definitely something that's going to change. The people that left the practices that we were with, they were doing subscription services, and it was $400 a month per person.
Yeah, that's astronomical in my opinion.
And
I
then
would say
you still needed hospital coverage and prescription drug coverage. That was just for your doctor.
right. Yeah. Yeah. You still pay out of pocket for like medicine and stuff like that for sure. Um, so there's still loopholes, of course, right? But it's just something else that could be offered, I guess.
Well, thank you with Sharon in the US. I think most of our audience members are here from the US. Fabiola, am I saying that right? If you want to unmute and tell us, or anybody else want to make a comment about what the healthcare system is where they're at? All right. Well, Grayson, do you want to go to the next? Our empowerment.
Yep, we're gonna skip this one and empowerment. So if you want to go for it, by all means.
So this was inspired by an event that again, that Healthcare for All Ohioans group took part in. And at the end of a recent program that they held, they encouraged everybody to fill out Post-it notes. And I've since seen a session online here where they actually used Post-it notes, but we didn't know we were going to have the access to that technology. So I'm just going to ask that you put in the chat your response to how you would defy disease and why you will. I will, so just sort of finish those prompts, any and all of them, or none of them if you're not interested, but any of them you want to respond to. Why would you defy disease? Who would you, or for what reason would you defy disease? What specifically could you do, the action you're going to take to defy disease? And then why do you have hope? Why do you have hope that we'll be able to overcome disease? And I'm going to just be quiet for a little while. So you guys and Grayson, we're just going to pause, at least give you a minute or two to think about that and provide your feedback in the chat, responding to those statements or completing them.
While I do that, is it all right if I jump in with the closing speech?
Yes, Matthew, because I see we're near that time.
Yep, go for it.
So as we wrap up this inspiring session, thank you all for being part of World Future Today, Young Voices 2025. Your perspective and participation have made this conversation truly meaningful. The journey doesn't end here. New facilitators and fresh conversations begin at the top of each hour, and you are welcome to stay and continue exploring future possibilities with us. So just some quick announcements. First, Teach the Future is offering our first future-wide Intro to Futures Literacy Fundamentals online course, and we have the Summer Institute for ages 12 to 17 and another course coming this fall for those 18 and older. Pre-registration is now open. And second, we'd love to hear about your experience. To share your feedback and receive your certificate of participation, please fill out our survey, which I'll share the link in the chat right after. Remember, our intergenerational voice matters in shaping our shared futures. Thank you for being part of this global conversation.
Matthew, thank you for providing that closing. I have to tell you that I have hope for the future, defying disease and otherwise, because of the young people here like you. I believe you're the youngest person I've seen here. You've done an excellent job. And people like you and the program itself, the World's Future Day Initiative, the involvement of people all around the world are the reasons I do have hope. It's Lisa, thank you for your part in organizing these events, and Teach the Future. Thank you for hosting.
Thank you for everyone that has watched and been a part of the presentation too. Being that this was like my first year doing it and kind of gotten a little crash course, this has been really good, and I've gotten a lot of information from you guys as well, just from the chat and just having this conversation.
So in the few seconds we have left, we'll read some of this back. I will defy disease by rethinking and revisioning disease. Let's try to host more dialogues and see if we're thinking about disease and health in the wrong way. I'm very unfamiliar. Okay. And I'm going to scroll down. Thank you. Mid-casting. And then we've got our links everybody needs. Someone says they're going to defy to protect a nephew. The people we love. That's a big reason. Especially, thank you. Okay, Grayson, tell us another way we can defy disease.
Yes, real quickly, World AMR Awareness Week is every week, the last week of every November. And it started in 2015. They have a different approach, different saying every year. And it's really, really great for knowledge and understanding, education. And that's where this all starts, is education. We can't do anything about this issue if we don't know. So I highly recommend checking it out. And I just wanted to leave everybody with a quote that you can see on the screen to kind of fuel your fire in defying disease and using futures thinking to do so. Also, that this is a global effort. Oh, yes. Always love a Howard Zinn shout out.
Okay, we timed it really well.